Hello everyone, Janie here. I'm the head physio here at Healthshift, and today we're going to be doing a really nice but an easy routine for the hamstrings, your sciatic nerve, the front of your thighs and a little bit of your core. So we are targeting all these 4 segments which are really closely linked and correlated with each other. So if there's any sort of pain or discomfort in one area, it usually also leads to loss of function in the other areas. So this session is designed to only warm up the sciatic nerve, your hamstrings and the front of your thighs to make sure that you're keeping your hips stiff free, a lot more mobile, a lot more relaxed, and of course if there's any sort of pain related to the nerve issues, this is going to be giving you a good boost of relaxation. You will just be needing a yoga belt or a resistant band like this, which can easily be used as assistance when we're doing the exercises. Let's get started with our feet together, hands wrapping around the TheraBand and your toes, and let's begin by pulling your toes all the way towards you and away from you, all the way towards you, all the way away from you. Now the idea is to make sure that your back is as arched and opened out as possible. We'll be doing 2 variations of this exercise, but the more you're able to use your hands to pull this towards you, the better sort of stretch you're going to be feeling behind your knees and your thighs. A couple of more seconds, let's keep going. This is a great warm-up. Make sure that you do not bend your knees at all. Perfect. Let's take a quick break. You can keep your TheraBand or your yoga belt at that same position while you catch your breath. We'll be restarting once again. Now, if you do not have either of the equipments, you can always use some sort of towel or a long handkerchief for the same. Come on, let's restart and begin. Drive it all the way down, pull it all the way back towards you. You should feel a very slow burning sensation all the way from the ankles, driving upwards towards your knees, driving upwards towards your thighs. The slower you can feel this, the better we're going to be doing this with efficiency. Couple of more seconds to go. You got it. Come on. Remember to breathe in and out with the movement. Almost there. 2, 1, and relax. Very well done. The next exercise is going to be focused more on the rounding of the back while we keep the ankles in that exact same position. So there will not be a change in the position of your ankles. Your aim is to round your back as much as possible. Let's go. Allow the ankles to go all the way down while you round your back. And we're just going to be holding this position for 2 or 3 counts before we arch and pull it back. Round your back all the way, lean forward. You should feel a mild stretch in your lower back and your middle back before you're pulling it back again close towards you. Don't pulse the movement or do it too fast. You want it to be very relaxed and very slow. 3, 2, 1, and relax. Very well done. Let's take a quick break. Have a sip of water if you want to. This exercise can be a little bit tougher for those who are in pain or have any sort of stiffness or any old back injury. So take it a bit slow if you're one of those. Let's begin the second round. Round your back, ankles down, arch your back, ankles up. Now this is also one of the very light level techniques to floss the sciatic nerve, which runs through all the way from your lower back to the tiptoes. We're giving it some space, some blood flow, and some more mobility through this exercise. Looking good. Breathe in and out with the movement. We're almost there. 2, 1, and relax. Very well done. Let's move on next to a lying down exercise. Here again, we're going to be working on individual leg mobility. Resistance band is going to be around the toes. You're going to grasp this hard, knees straight, And all you're going to be doing is driving it a little bit down and away from you, and use the band and your hand to pull it up straight behind. A little bit away from you, all the way up. We do not want maximum range in the first set, so take it slow while you understand the boundaries of your discomfort that you're able to tolerate in this movement. You can even close your eyes while this movement is happening. Almost there, keep going. 3, 2, 1, and let's relax. We're going to shift to the second leg. Come to positions. And let's begin. Down and away from you, up and towards you. No bending of the knees of the leg that is moving. Nice work. Keep moving. This is also a nervous system regulation exercise. That's why it's fantastic for active recovery days. Keep working. Deep breaths. We're almost there. Three, 2, 1, relax. Amazing. Now the second set is going to be a bit more advanced, because here we're allowing for full range of motion to happen, and the opposite knee is not going to be bent, it is going to be fully straight. So come into positions and let's begin. Drive it all the way down and pull it all the way back while your toes are pointing towards you. Of course, you need to make sure that you're moving in a way where your knees do not bend like this. So only go as far as you can go where the knees are straight. If you feel like the stretch is getting a bit too intense for you, feel free to bend the opposite knee like this, like we had done in the first set. Otherwise, continue without it. We're almost there, and let's relax. Come to positions of the second leg, adjust the band well, take a couple of deep breaths, and let's begin. It's always good to keep your eyes closed when you're doing exercises like this, so that you can build a little bit more connection with your nerves, with your muscles, and with your mind. Hang in any position where you feel like your stiffness and your stability can be improved. See, instance for here, if you're struggling the most, hang in here for the little bit time more than the other ones. Pain is gain, at least in these areas. Relax. Well done. We're now going to be moving on to a very nice and a very easy mobility exercise for the shoulders. Again, using the same TheraBand. Hands are going to be all the way up. All we're going to be doing is moving to one side as much as possible. The moment you touch the floor with the same hand, try to take the opposite hand away from you while we simply hold this position. It might feel like we're just holding this, but your body is working extremely hard isometrically to keep you in this position. Tap the floor or take your hands forward like this after a couple of repetitions and restart the exercise like this. Deep breaths. Almost there. And let's relax. We'll take a quick break, do a couple of flicks of the hands while we move on to the other side. You may also use just one of them instead of two of them if you find it to be too tough. let's begin. Hold for a couple of seconds, keep your body tight, and then relax a bit forward when you need to before you continue again. Perfect. This exercise is also targeting the sides of the body, which is very, very important to get your hips a bit more opened up for the next exercise. And relax. All right, that was one round of this. Now we're going to get ready for the last exercise, where we're going to be targeting the front of your thighs and the femoral nerve, which is very, very important for the front of the thighs. All you're going to be doing is bending your knees, using the same side hand and pulling it all the way down. From here, I try to rotate all the way out, come to neutral. Rotate all the way out, come back to neutral. It's a very feel-good stretch. And this is also extremely important in case you're a sedentary worker who's working at home all day or sitting at home all day, or of course, desk workers who are required to be sitting on the office chair for 8 to 9 hours per day. Your hip flexors or the front of the thighs get very, very tight, leading to a lot of posture issues. And this exercise is a perfect anti-sitting routine or anti-sitting exercise, if you want to label it. You can do this while you're also about to get ready for bed or just waking up in the morning. 2, 1, let's begin. Drive it out, drive it in, drive it out, and drive it in. Let's go. Do not forget to breathe. No holding of your breath here. The more you can rotate, the better it is. Very nice. We are 10 more seconds away. 3, 2, 1, and relax. Let's finally finish in an all fours position, where you simply arch and round your back for a couple of seconds. You should be feeling it yourself that the mobility is feeling and looking a lot more better than you started the routine, before you start the routine. I'm also feeling great, so I'm sure you are too. Take care, well done today, and I'll see you in the next class. Bye.